Thanks so much, Dr. Cohen. I appreciate your leadership. We're encouraged to see North Carolina holding steady on most and decreasing on some of our key data metrics. North Carolinians, most of you are showing you know how to fight this disease, and most of you should be proud of yourselves. Remember, every time you wear your mask or social distance, you're helping our statewide numbers so we can ease restrictions. You're protecting people, known and unknown. You're saving lives, and you're slowing the spread of this virus. Because of our stable numbers, today we're ready to take a careful step forward. North Carolina will move into Safer at Home Phase 2.5 beginning this Friday, September the 4th at 5 p.m. Here's what will happen. First, our at-risk population is still safer at home. For those over 65 and those with health risk, we urge responsibility in your choices. The limits on mass gatherings will increase to 25 people indoors and 50 people outdoors. Playgrounds will be allowed to open. Museums and aquariums can open at 50% capacity. Gyms and other indoor exercise facilities can open at 30% capacity. The age requirement for mask wearing will include children down to age 5. Capacity limits at restaurants and personal care businesses like hair and nail salons will remain the same. For all of these, there will be additional safety measures required. Some places will remain closed, including bars, nightclubs, movie theaters, indoor entertainment, and amusement parks. And large venues will still be subject to the mass gathering limits. We know that big gatherings are among the most dangerous settings for transmission of this deadly disease. Also, as we announced yesterday, the 11 p.m. curfew on alcohol sales at restaurants has been extended to October the 2nd. Safer at Home, Phase 2.5 continues our state's dimmer switch approach to easing some restrictions. I want to be clear. We can do this safely only if we keep doing what we know works, wearing masks and social distancing. Moving to Phase 2.5 means that we can safely do a few more things while still fighting the virus as vigorously as ever. In fact, a new phase is exactly when we need to take this virus even more seriously. Wear a face mask, wash your hands, make sure that you're waiting 6 feet apart. These things have never been more important. And until we have a vaccine or a reliable cure, the precautions like the 3 W's are with us for a while. Life may look a little different these days, but every time we wear a mask, we help our economy by slowing the spread. We make it safer to visit our favorite stores and restaurants and other businesses. Wearing a mask is an easy way to look out for people. I've seen the tremendous things that North Carolinians will do to take care of each other. After a storm, a flood, even an earthquake or a local crisis, a mask, that's not hard at all compared to the lengths I've seen North Carolinians go to help each other. So let's keep doing what we know works. Let's stay strong, and let's beat this virus. I know we can, and I know that we can come out stronger on the other side. Along with Secretary Cohen, also with me today is our Secretary of Public Safety, Eric Hooks, and our Emergency Management Director, Mike Sprayberry. Jennifer Boyd and Brian Tipton are our sign language interpreters. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We will now take questions from the media, and if you can make sure you identify yourself and the organization you represent, we would appreciate it, and we'll take our first question.
Our first question is from Gary Robertson with the Associated Press.
Hey, Governor, it's Gary Robertson. Not a tangential topic, but obviously the legislature's coming back tomorrow, and you may have seen bits and pieces now of the package, the COVID relief package that they have, which would include giving about $300 to each family in direct payments, and also expanding eligibility for opportunity scholarships. I wanted to know what you thought about the package, given what you know about it, and whether you have concerns or support for it. Thank you.
I haven't seen anything at all about it, Gary. I understand they unveiled it this afternoon. We will read it very carefully. We want to keep the health and safety of North Carolinians as the first priority, and we'll certainly work with them as the process goes along. I hope that they will continue to look at the budget that I presented. We'll certainly look at what they have presented this afternoon, and hopefully we can come up with a package that'll be positive for North Carolina. Next question, please.
Our next question is from Kenny Beck with WXII.
Good afternoon, Governor. Kenny Beck, WXII. Thanks for taking my call. Dr. Cohen referenced the fact that there was a little bit of a surge, a spike in cases in mid-August, particularly among younger people with back-to-college season. I'm curious, is she and are you anticipating another spike once we enter phase 2.5 starting on Friday?
Well, first, one of the reasons that we paused in phase 2 was the fact that we knew that our public schools, K through 12, and our colleges and universities were opening. And we anticipated some virus spread. If we continue doing what we need to do with wearing a mask and social distancing and washing our hands, these careful movements forward should not affect the viral spread, because we know that it's going to be important for people to keep working